Greetings all. My name is Julia Chaves. I'm a student from the Federal University of Pelotas in Brazil. It's an honor to present to your consideration our study entitled Aging Aggravates Acute Oxaliplatin-Induced Peripheral Neuropathy in Mice through the Increase of Oxidative Stress and Modulation of Sodium-Potassium ATPase. Beneficial Effects of 7-chloro-4-phenylselanyl quinoline, performed under the orientation of Dr. Recebeu and co-orientation of Dr. Cristiane Lucchesi. The number of people that live into old age has enhanced. It is estimated that 20% of the world's population will be over the age of 60 by 2050. Moreover, the aging process is characterized by decline in physiological function with progressive degradation and reduced repair capacity of the organism. The highest incidence of cancers occurs in patients over the age of 60, and colorectal cancer is one of the most common malignancies and leading causes of cancer-related death worldwide. Oxaliplatin is a platinum-based anti-cancer drug used in colorectal cancer treatment and induces various side effects, including peripheral neuropathy. Thus, older patients in oxaliplatin treatment are more susceptible to side effects, mainly pain. In this line, new therapeutical approaches should consider the aging peculiarities in search of therapies for oxaliplatin-induced acute peripheral neuropathy treatment. 7-chloro-4-phenylselanyl quinoline 4PS received by intraperitoneal route oxaliplatin 10 mg per kilogram. On the last day of the protocol, mice were treated with 4PSQ 1 mg per kilogram intragrastically half an hour after oxaliplatin administration. 30 minutes after the 4PSQ treatment, the behavioral tests were accompanied. Firstly, the animals were euthanized and the sciatic nerve, spinal cord, and cerebral cortex samples were dissected for ex vivo assays. Hypersensitivity to cold and pain are common acute clinical symptoms of oxaliplatin-treated patients. In our study, we evaluate both in the acetone drop method and the von Frey test in Swiss mice. Interestingly, our results have shown that older animals are more sensitive to mechanical figure 2A and cold figure 2B stimuli when compared to the young group. Also, oxaliplatin administration produced mechanical and thermal sensitivities in both ages. 4PSQ was able to normalize the hypersensitivity of both ages induced with oxaliplatin. No significant difference was observed in the cold mechanical sensitivities of mice treated with oxaliplatin and 4PSQ, regardless of age. These results revealed that the treatment with 4PSQ protected against hypersensitivity induced by both oxaliplatin and aging. To confirm the contribution of oxidative stress to oxaliplatin-induced acute peripheral neuropathy, reactive species levels, figure 3A, B, and C, and metric group, the involvement of the sodium-potassium ATPase in the spinal cord and cerebral cortex were evaluated. Dysfunction of the sodium-potassium ATPase activity is linked with neurological issues and resistance of cancer cells. Aging significantly decreased the sodium-potassium ATPase enzyme activity in the spinal cord of mice when compared with the young group. Exposure to oxaliplatin decreased in the spinal cord and cerebral cortex sodium-potassium ATPase activity of the young and old mice. We highlight that the treatment with 4PSQ reverted the effects caused by aging and oxaliplatin of the sodium-potassium ATPase activity. This study helped to expand understandings about the mechanisms involved in the physiopathology of oxaliplatin-induced acute peripheral neuropathy and advanced in the research for a new therapy. Our study demonstrated for the first time that aging exacerbates acute peripheral neuropathy induced by treatment with oxaliplatin. In this sense, our findings demonstrate that the effects of 4PSQ seem to be due to antioxidant and neuroprotective effects, mainly for its ability to reestablish activity of sodium-potassium ATPase enzyme. Those results suggest that 4PSQ might be a good prototype for the development of a more effective agent for oxaliplatin-induced acute peripheral neuropathy treatment. Thank you very much.